For days now, these medical practitioners have been out on the streets protesting against a controversial bill, the Right to Health Bill. It was passed in the Rajasthan Assembly on the 21st of March 2023. What is this bill really all about? This gives every resident of the state the right to avail free outpatient department services or OPD services and inpatient department services at all public health facilities. Free healthcare services including consultation, drugs, diagnostics, emergency transport procedure and emergency care will be provided at all public health institutions and select private facilities subject to conditions specified in the rules. All residents will be entitled to emergency treatment and care for accidental emergencies without prepayment of any fee or charges. In a case of a medico-legal nature, the bill says no public or private hospital can delay treatment merely on the grounds of receiving police clearance. A patient will not be required to make an advance deposit or prepayment for either treatment or diagnostics, even at a private hospital. In case a patient can't pay for his treatment, the state government will reimburse the hospital. A patient also gets the right to choose the shop or the lab from where he wants to buy medicines. For any violation under this act, a hospital or doctor will be liable to pay a fine of 10,000 rupees that increases to 25,000 for subsequent violations. So why the opposition then? Doctors say there is going to be a great deal of bureaucratic interference. They also say the proposed bill would gradually eliminate private hospitals. It would take away from the doctors the right to earn livelihood. They feel the government is shifting its own responsibility to private doctors. Lack of clarity on how the reimbursement would happen. Doctors believe this will fuel mistrust between the doctor and the patient. They also want clarity on what an emergency is. They fear exploitation by patients. Doctors say the proposed bill infringes on the rights of doctors and there is going to be over-regulation of the medical industry. It's an impractical approach. Doctors say this was not even needed and cleared without talking to the stakeholders here. Who then gains from the bill? Patients, undoubtedly, though there are concerns that taxes will increase eventually for the government to fill in the coffers. Politically, the Congress government is looking at gaining the trust of the people and eyeing to return to power in the upcoming assembly elections. Which of the states have implemented the right to health then? None. Rajasthan is the first state in India to implement this bill. In New Delhi, Sneha Mordani for India Today.
For more informative videos like this, keep watching India Today NEWSMO.